Well, we stalled long enough, so let's go ahead and get this going. At this time, welcome everyone to the People's House. Glad to have you. At this time, I'll ask the City Clerk, Beth Davis, to please call the roll.
Commissioner Jeff Sanford.
Here.
Commissioner Sharon Neesmith will
Almost.
be here shortly. Mayor Tom Watson.
Here.
Commissioner Curtis Maglinger.
Here.
Mayor Pro Tem Bob Glenn.
Here.
Thank you. This time, if you're able, please stand and remove the cover for our invocation and our pledge by Commissioner Maglinger.
Let us pray. Dear Heavenly Father, thank you for the opportunity to serve our community. Grant us wisdom, patience, and integrity as we make decisions for our community. May our work and decisions be guided by compassion, caring, and love. In Jesus' name we pray. Amen.
Amen.
Allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay, we have a few presentations tonight. First one's Owensboro Health Annual Report. Mark Marsh, President and CEO, please come to the podium. State your name and address for the record.
Sir. Okay, I'm gonna let this.
Either one of you.
There you go. My name is Gavin Roberts, 25 Stone Creek Park. It's my honor to be the chair of the Owensboro Health Board of Directors, where our mission is to we exist to heal the sick and to improve the health of the communities that we serve. We've got a great, thank you. Got a great team with us. Mr. Marsh has been here just over 3 years. We're very pleased with what's going on at the Owensboro Health current campus here, where we have close to 5,000 teammates. That includes some partnerships that Mark will probably talk about as well. So I'll turn it over to him, Mr. Mark Marsh.
Thank you, Mayor. Thank you, Commissioners. Thank you, City Manager. And appreciate it. It's an honor. These years roll around awfully quick. It does seem like it was just a couple weeks back, and here we are again. But a lot of excitement going on. Certainly, hopefully I can go through just a couple slides. I'm going to hit the highlights here. I know you got a lot of business to conduct, but before I get started here, I do want to just take a time because Gavin talks about, and you'll see partnership woven throughout this presentation. I think that's the thing, Mayor, you talk about all the time. You know, we're too big to be small and we're too small to be big. But I think there's a lot in healthcare, and we want to do our part. We want to be a great partner. So hopefully you see that throughout. But I want to recognize two groups here. We talk about partnerships here, and we can't do it without these great representatives back here in the back with OPD. We know that. They are great ambassadors and helping us, and we've got many examples that we call them, and I feel like we've built a great relationship with you, so thank you, as well as the fire department. So thank you. And those are two examples here of many, and I'll reference here, but thank you for what you do and bringing great people out there that get a partner with us every day. So as Gavin said, our goal is certainly to not only heal the sick, obviously, but more importantly, it's about improving the lives of those that we get to serve. And we believe as the team you're going to see here, and I'm blessed every day to work along these great leaders here. As we take that very seriously when we walk through those hospital doors or anywhere throughout this big region, it's our ability to serve others. And we got in that for a reason. So let me just jump right in. Hopefully what I'll share, a little bit of the irony of this right now is it's fun. As I'm sharing some of these same slides, I'm in the middle of what we call our town hall sessions. And so I do this once a quarter. And then we have our other leaders at the various hospitals do it as well. And so my goal is that the 5,000 plus team members here, I try to get in front of roughly 3,500 of those folks. And so we've gone through, I'll do 20 of these. I'm about 4 left remaining, and I can go over from Muhlenberg to Henderson to Grayson County, everywhere else. But it's great to be in part of those team members. Like I say, it's not the bricks and mortar, it's the people. And I think that really is representative of here at Owensboro Health. These are 6 of our core commitments. And so as we model, we think about those core commitments and what they stand for. Again, I'm not going to read all these verbatim, but this is kind of the foundation of who we are and really the history of Owensboro Health. And as we think about teamwork and respect and all those things that are core values. And that is something that's really important for us. And so we try to model that and certainly weave that in throughout. And then I'll talk about what we're doing with students and innovation centers and elsewhere, but around these core commitments. So this is really who we stand for. The next slide you're going to see really is just our market. As we think about the 17 counties that we talk about, our service area, which is growing. We're excited about the growth here, and we like to see that growth throughout these respective communities. But you can see the footprint, certainly where our primary acute care facilities reside, as well as the mini clinics, and so I'll share that with you. But again, roughly 600,000 lives that are in that primary service area. Next slide just kind of shows you the makeup of what we comprise of. As you can see, the 5,000, 5,800 plus team members, the various health plexes we have, hospitals, but it's really about improving access points throughout. And so I'll show you ways we're doing that and a lot of ways that we're doing that. So this is kind of our footprint and through those services. Next is really the services is that we offer. And so a lot of our recruitment, what we do is we look at those needs and what patients can be served here in a high quality, ease of access, and a very patient-friendly environment. And so we've expanded. And so there's a lot of folks, and we got some of our physician leaders back here, and Dr. Dufresne and others. And so it's really about collaborating with our physicians. And so you'll see a lot of what we're doing. We've advanced a lot on some of these unique areas. And so again, we think it's really important if we can provide these great quality care throughout the entire region. So pretty comprehensive list that we're able to do. And so you're going to hear a lot more through this year about us doing storytelling and making sure people are aware of sometimes with social media and other platforms, we want to make sure people are aware of what they're capable of receiving throughout this region. And so again, I'm more impressed with the quality of the physicians that we're bringing in. So that'll kind of lead me, and I'll show you in a second about the quality of the physicians that are coming here to care for us and our loved ones throughout the region. Next is, so these are some of the physicians. So you think about 115 physicians in the last 4 years. We've recruited 63 new physicians in the last 2 years. And the first thing everybody says, well, that's great. How many are staying? There's benchmarking. So we have about an 88% retention rate. People do come and go. So people come and go, and there's people that move for various reasons, family reasons. I won't go on the individual. I just had a great cardiologist, unfortunately, a spouse, and need to go back to Virginia. So again, I can go to each one of those. But we work really hard. And I'll say our team is pretty much involved in every one of these recruitment efforts. That's one of the things that we really sell, is being able to collaborate. Is we don't have the bureaucratic structure. We can do that. You're there. We're talking about service line, how to advance things. And so we do that in a very partnership. But again, we don't want to lose our folks. These physicians are really important to us to be able to meet those needs, those services. One of the things I'm going to tell you a statistic right now. So Merritt Hawkins is a national study. They do a lot of studies. So for every physician that we bring in, on average, anybody have an idea what the economic impact is for each physician that's brought in? You probably know, don't you? I know. $3.2 million. So just in the last 2 years, those 63 physicians brought in nearly $200 million of economic impact to this region. So we want that because we want them to do those services here to provide that care, but we also make sure that money and that stuff stays close to home, right? And it's serviced here. Each physician, on average, between indirect and direct personnel, it's about 15 FTEs per physician. Again, those are economic reasons. We want to do it to provide great care, but you can see that really is an economic engine, we believe, and really important to the region. Next is, again, some of the statistics here, just with a few of the number of emergency rooms. We're almost 100,000 in emergency room visits between the three facilities. You can see we've improved a lot in these 14-day access. That's a benchmark we want to improve. And so getting into physicians, you'll see in some communities, and I don't want to pick on Nashville, but in some of these specialties, you're 3 to 4 months out to see certain specialties. So we really want to understand that. It helps us our recruitment to understand, but primary care is a big piece for us. As we know, preventative care, right? We don't want to have people overusing or abusing the ER. We want them to have that preventative care. We've seen in the last 2 years, we've had 30,000 more primary care visits. 30,000 more folks were able to have primary care visits that didn't have in the past. Again, I don't call each of our respective leaders here, but Matt Cowell is over our physician services, but that's been something we've been really working at, is to bring the high caliber folks and making sure people are aware by getting people in less than 14 days, and we've done a great job in that. So as I shared, obviously the largest employer west of Louisville, there you can see the numbers again, about 5,800 FTEs there. And once again, I always say this, 50% of our workforce resides in Davis County. So 50% of our workforce resides in Davis County, which is really important for us. And people want to live and work close to home, so that's a great thing. This next number, I told you last year, Mayor, we were getting close to that half a B number. You can see what happened just in this last year. We've surpassed. So our salaries, wages, and benefits surpassed this past year $500 million. $500 million. So $500 million in our salaries, and we're glad that we can do that. But obviously, I think we all know each in our respective businesses, workforce is getting more and more challenging. Getting people there, the cost of wages. I won't even get into and tell you the individual things, and so nothing's getting cheaper. And reimbursement's not always getting better, right? And it's getting tougher with Medicare, Medicaid. So I'm not here to cry wolf, but again, it's not the business that you think. As costs go up and reimbursement goes down, it's kind of that tougher challenge. But again, still doing extremely well. Next one is some of the statistics you've seen in the past, is kind of talking about some of the economic impact, as I shared with you. About $4.9 million in occupational taxes paid. I'm not going to read each one of these, as I shared with you. The bottom one, the 63 physicians we've recruited the last 2 years, it creates a little bit close to $200 million in economic impact for the region. So again, obviously we want to do our part on the charity, those are uninsured, not as capable, and so we provide it to all. And so we're fortunate, we're glad that we can do that. It's a 501c3, but as this being your community hospital, this is doing our part. It's really being a great partner for everybody that resides in this community, and we're glad that we can offer that. So the next few slides, I'm just going to walk you through, is we kind of 3.5 years, we started to build kind of the framework, I'll say, for the system. And then the board was very involved, our leadership. So these are our 6 strategic imperatives. These are our pillars. And so everything we do is we start thinking, we're already putting on our business plan and working on our initiatives for next year. We're 8 months, a little 8.5 months into our fiscal year, which ends the end of May. But everything kind of touch and cascades into these 6 strategic pillars. And so you'll hear where I talked about the quality and talking about partnerships and working with our physicians, being a great place to work. Well, we truly believe these 6 are really the driving force of what makes Owensboro Health and what has made Owensboro Health for many years. So this won't change. Tactics and strategies within will, but again, this is kind of our leading pillars. So just in a couple of these things, I'm a picture guy. I can share a couple of the pictures that kind of touch on those pillars. And obviously, we want to be a high-performing facility. U.S. News and World Report, many have heard from. A lot of efforts we had, certainly around orthopedic, stroke, heart care, great advancements there. Obviously, some of the latest, greatest technology up in the front center there. Top center, you'll see that's our new Ion robot. That's our pulmonary critical care docs. That's a new piece of technology now for cancer care, things that are in the thoracic area. Now that we can do things instead of sending labs out and waiting on things, now all of a sudden these things can be detected much earlier, which you stop cancer. And so I can guarantee you, with Dr. Brazier and others in there, this has been one of the greatest advancements we've had in this region. It's been a great success, and you hear Dr. Brazier can certainly tell it much more passionate than me, but we're fortunate to have this great technology and even greater doctors. Same with the robot down there, right next to, you see the little fiddle, and I'll come back to that. So the robot, the Da Vinci robot, we were able to purchase one of those, partnered with Muhlenberg County. So we got 2 great general surgeons. So now we have a robot down there, a Da Vinci robot, where we have 2 great surgeons where people can have their colonoscopies or other types of surgical surgeons down there, and Muhlenberg will be right there close to home. And so that's been a great addition to the Muhlenberg population. Some of the others, the cardiac advancements in the bottom left. And so the one, it's kind of fun. We think about of our respective communities. So we really want to promote health awareness. So Grayson County, and so we started that and working with the elementaries and the schools over there. And so that bottom right-hand corner, you see something that's called Fit Fiddle. So they came up with their own community mascot there. That little mascot there is known all throughout Grayson County. It's got its own country music stars, has a song and dance. I was on the square during Thanksgiving, and let me tell you, Fit Fiddle, you can ask any kid, they may not know the high school mascot, but they know who Fit Fiddle is. And so, but the point is, it's about partnerships, so small things you do to collaborate. And so that's been a great success and a great success story for us down in the Grayson County market. Some of these I've kind of touched on already. So we pride ourselves on quality and safety, right? First and foremost. If we can't do it to a high quality experience, make sure it's ensuring safety. And then with a great patient satisfaction survey, then we ask our questions, why are we doing it? That's the first, that's the why. So a lot of this is just some acclamation. It's just a validation of the great work we're doing. Whether it's U.S. News and World Report, whether it's, we have Joint Commission that regulates us, it's whether it's some of these other types of agencies. So it's more of a validation of the great work, because I can't tell you the amount of work that's going on behind the scenes to make sure we put the right systems, processes in place to ensure patient safety is first and foremost. So a lot going on. Obviously, Bottom right, Dr. Danitz, and this thing's moved more from the inpatient to outpatient wound care with our diabetic population. It's very huge, and that's been a great success, and they do a great job here. And then certainly right above us, Muhlenberg. Muhlenberg Community Hospital was recognized just this most recent as the top 4th hospital in the ranking system, but they do great work. Though they may not do as much complexity things that we have, but the quality of care and the things that they do it to a very high standard. So very pleased with what Muhlenberg Community Hospital is doing. Next is just some more pictures. Obviously, the fun, and I know I want to get the one carved out because I knew Mayor would pick on me about throwing the football, but one of the things, the partnerships we do, anybody's been to any of the high school games, obviously it's little things, but it's the partnership. Like I said, I was down at Ohio County last night, did a basketball game. Russ and I were down there with Ohio County and Hancock. But those little things about showing our support with these schools, being embedded in those schools, and maybe gimmicky to throwing the football, but how do we support them? How do we help them in teaching people about education, things that we can do to help advance things in these schools? And so those little partnerships go a long way. And so that's one of the things Game On. DJ Johnson down the bottom right-hand corner. For those, DJ had this idea. It's an adult changing station that we have at the hospital. We had a need, and folks were coming in. They didn't have that. We put that in, and let me tell you, it's been a great asset. So it's the small things that make a difference. But really proud about that. Obviously, the Fit Fiddle I shared with you. We do health fairs in the top left-hand corner all over, constantly working with the industries. I meet with the industries on a quarterly basis with our folks here and say, how do we help? We all know healthcare spending is on the rise, right? There's not a small business out there. It's crippling small business. But we're trying to find ways to help them to navigate through that, how they use their resources the best way possible. So constantly looking at ways how we can streamline the healthcare through the businesses. Obviously, we want to grow. There's no doubt about that, and certainly we want to grow for the right reason. These are just some various things that we are growing. I've mentioned certainly the physicians, access, expanding our footprint. One of those in the top right-hand corner, Dr. Adrian Smith, our new neurosurgeon here in town, has done an incredible job. Been here close to a year. We got a second neurosurgeon recruiting. So one example of many ways where we can grow, where patients don't have to travel. They don't have to go across the river, go to Nashville, and so on. So Dr. Smith's been a great addition. AI. That's the new buzzword, right? We know AI is there, and there's things that we're doing on virtual nursing, things that we're already ahead of that. But we know it's on the horizon. Healthcare is going to be a part of that for various reasons. And so Dr. Bridget Bashir, certainly a great neonatologist for us, one of our great doctors, but she's had a passion. And so she's working with us with our partnership with Optum and others. And so where we can bring this new technology, these more advancements around AI into that. And so she's been a big blessing for us. And so you're going to hear a lot more. So each year, so I come back, have the opportunity to come back, I think it will tell you more and more advancements. Again, and don't want to get in the weeds, but to see the stuff. And so we'll be emulating a lot of that in the Innovation Center. So a lot of things that we're going to do, and when I talk to you about the build out of that, it's 38,000 square feet of new technology that will be state-of-the-art, first of its kind in the state, be able to do things in teaching and educating young adults around that. So excited about that. Top center, Jason Collins, that's our director of pharmacy. He and some others, we added our outpatient pharmacy. We want to make it easy for folks with our Springs, and now it's now known as Owensboro Healthplex. And again, we've moved away from that. We want to keep that symbolic with the others. But Jason, we built an outpatient pharmacy there. It's making it easier for them. They're filling, Gavin asked me the question the other day, they're filling 1,000 scripts per day in many days. So again, it's just easy to show the need, and it makes it really easy, but that has been a great addition. The bottom center, radiation oncology, our Mitchell Memorial Cancer Center is phenomenal. They do great care. I can tell you how many people have stopped me and said this is incredible care that we do. Radiation therapy is certainly one of those modalities. That's our brand new linear accelerator, the second one we have. It's the latest, greatest. There's not a newer one in the state. And so again, they're getting the latest, greatest, up-to-date modality there. And that's two of our radiation oncologists, Dr. Abel and Dr. Newberry and the team. And so I can tell you, as I go around to different places, we have a lot of great facilities. But I heard the word compassion in your prayer. Thank you. But I can tell you, when you think about compassion, respectful care, and those things we do, there's no one that does it better than our Mitchell Memorial Cancer Center. They're an amazing group, and you guys know some of those folks, but they do great care. And then the last one is just the top left. That's the expansion. So we think about taking healthcare out to those areas. And so most of the specialists we bring in now, we ask them to go out and do outreach as well. So those 10 new physicians, that's 10 new physicians we brought to Grayson County. So I can tell you now, folks who are in Grayson County, Breckenridge, and those others now who don't have to drive, and that's neurology, medical oncology, general surgery, orthopedics. That's been a great addition. And so again, I'll be doing the same thing with the foundation board over in Grayson County here in about 2 weeks. So it's great to see the advancements we're making throughout the region. So another great advancement. So these are some of the doctors, some of the pictures. And so I shared the 115, but just in the last 2 years, some of these overlapped in 23 and 24, but it's 63. But there's 63 new physicians. These are 52 of the pictures there. You may recognize, I won't go through each of these, but obviously from a new neurosurgeon, new CT surgeon, 4 new primary care doctors in Henderson, new neurologists in Grayson County, and so on. So again, this is a great example of what we're doing, not just the economic impact, about being able to offer great care, exceptional care throughout the entire region. So we're proud of that. And what I like the most, each of them are very involved. One of the things we've prided ourselves, and we said what helps to recruit them there, is we want them to be a part of this, is to help us with our service line development. How do we expand? How do we improve on our qualitative services? How do we improve our access? And so we have quarterly meetings, what we call service line meetings. Dr. Dufresne, Mac, others who lead those things, but we're sitting beside those physicians and really advancing the healthcare throughout this region. Quickly, I know we all had to be nimble. We talk about what we have to do and trying to manage through things. So everybody recalls the storm we had, Helene, right? It took place back in the fall. And so this is an example where you have to navigate. It's kind of like being that audible, right, Coach? And so we had to do the same thing. So if you remember Helene, Baxter is a big supplier for us. So most of our big IV sedations, our fluids, things we have to use for IVs, but more importantly, some of the flush and things for big orthopedic cases, urology. Well, obviously, you guys, for those who read, 80% of the Baxter was done out of North Carolina. Well, on that, they never thought it was a 100-year floodplain, didn't know, all right, put it up there. Well, that wiped us out. So we had to go 3 months. The teams had to go where we had to delay a lot of these cases. We had to do things. Our teams, our folks in pharmacy, or operations, MAC, all of us together. And so that's a hardship. Think about that as a patient. I'm expecting I'm going to have an orthopedic, right? Knee, I've met my deductible, those things. So those things we had to delay. We've just now, within the last 2 weeks, got our standard supplies back up. So that's been a challenge, and so that's part of healthcare. And so the average person wouldn't know that in the community. It's hard because you know what? Hey, I'm going to get it, met my deductible. I'm going to get this done. I can do therapy around the holidays. And so I'm sorry, Mrs. Jones, we can't do it right now for this reason. So that was really hard, but there's a lot of coordination. But again, this is a great team who we navigated through it, and we're better for it. So patient experience. Again, if I'll say one thing that we strive every day, and hopefully you've seen this interwoven. So I shared with you, we made a transition from a group called HCAPS to NRC 2 years back. NRC, really what it is, it gives us more accurate data in a more timelier manner. So we stress this. This is something we stress throughout the hospital every single day. We have things called GIMBA boards in all of our different units. We talk about with the team members. Soft skills is not something that comes common, and so we think about what soft skills are. People, we got to make sure you get the right antibiotics and do the right surgery, but how do we treat people with those core commitments, with respect? Be able to sit down and listen, right? Make sure you're included, you know what's going on. When I get a complaint, people do call and say, hey, things didn't go wrong. Typically it's not about, hey, they got me the wrong meds, or it's about, you know what, it's one of those encounters with one of those team members or somebody didn't inform me, right? I share, on an average patient stay, it's about 3.5 days. So average stay is about 3.5 days. How many different interactions, if you start from 70% of our patients, they originate through the ER, emergency room. And in those 3.5 days, how many different encounters would you potentially have with different team members? Up to 100. So by the time you see a triage nurse coming in, you can see security, you may see 20 people in the ER between a rad tech, lab tech. How many of those encounters with one or those 100 individuals, how many do you need to have one before it could be a bad experience? One, right? That one encounter could be something bad, and all of a sudden now it wasn't a good, we did everything right, but we stress it. And so those are the things that we're trying to certainly weave in with our team members to understand that. The younger generation is woven in, but again, patient experience, we all know that drives people. That's why ERs, a lot of times, they get recognized right at your front door, but people determine, right, if it's a good hospital or not is how the ER is. But I just share that with you. Our numbers there are amazing. Moving the needle, 3.1, may not seem a lot, but every health system is focused in trying to improve this measure for a lot of different reasons, not to mention monetary reasons within the state. So again, there's monetary gains or losses based on how you perform, but again, very important for us. Next few things, this is just a quick snapshot as we manage our certainly our Facebook and all the different forums. We have our marketing team. So these are just a couple quick snapshots that we see, and they're very simple, but kind of reflects on how we are with customer service. Oops, excuse me. But I couldn't believe how fast it was taken care of and how caring everyone was. Everyone was great there. They listened to you, so those key attributes that we really lean in on. But again, these are just a couple examples. We see these every day. We have a team that manages these, and so something we pay attention to. Next one is really just about telling our story. And I've shared that about, being a great marketing, and certainly you want to market something, and you don't want to go market something you can't deliver upon, right? Exceed expectations. But you're going to see even more this year. We've done a lot. And again, it's not just billboards. Social media has changed a lot of way how we do that. We want our 5,000 team members to believe in what they do, to go tell those stories. But we want the people to be informed what we're doing here. We want you to be informed and know what service we offer. We want to live up to those expectations. But one of the things we're going to do this year, we're working with a group, and so one of the ways we found it very effective is called patient testimonials. So this year we're going to take, and I don't want, it's not HIPAA stuff, but I got people that stop me every day and say, Mark, I know you hear all the negative things, and we have plenty of mistakes, but we want to help tell the stories of the great things that your health system's doing, in the ways that you can care and how you're caring about us. And so again, we're going to work on that. Doesn't mean we're going to continue to improve in other areas, but this year I think we have a great way to tell our story even more so that people understand the services we have to offer. So I think I've asked, and I recall, I think it was in here, Mayor, a couple years back, that somebody asked about what are we doing about our geriatric or aging population, right? And ironically, I felt like it was teed up for us as perfect. And so lo and behold, we were right in the middle of working with some geriatricians. And since then, Dr. Collins and others have joined us. So since all that, CMS has come, Center for Medicare, they've come out with something we're going to be required. Initially, we were offered this, so it's called age-friendly, all right? And so we know, as you can read right there, by 2030, 1 out of 8 of our population is going to be over the age of 65. They're saying by the year 2035 that we will have more individuals over the age of 65 than we will under the age of 17. So again, growing population, so more. And so this age-friendly, what it is, it's a process. We volunteered as a health system. CMS came out there. We were one of many, but only 30 was accepted. So there's only 30 health systems in the country right now. The next closest one to us is in Chicago. Not another system in Ohio, Indiana, Tennessee, West Virginia, and so on, but Chicago. So this is really about setting this standard up about how we best serve this aging population. There's so many components under these, what we call these 4 M's. And so the work, it's about a 90 to 120-day process. We've got 10. We got a potential of 20 by the end of the calendar year. We've got 10 that are already set in place. So this can allow us to better serve and better care for our aging population. When I show you a graph here later, you'll see why. Is because I think the folks, as we advance our technology, the folks who are going to be in the hospital are going to be more in this population. You're seeing advancements around technology and elsewhere, but again, this is something really important you'll be hearing more about. But ironically, 2028, every health system now, because they've seen the success and where they think this is going to do or where this is going to go, it's going to be a requirement. So if you participate in Medicare, 2028 as a health system, you have to be age-friendly. So again, I'm glad we got a head start. Last one here, I won't read through all these. Obviously, we got some of our great partners. I talked about partnership. And so, we look at our social determinants. And some of those social determinants, and I know Debbie and others are here. And so 3 of the things that we really looked at the past couple of years, it plays into our grants and how we partner. But again, we know mental health, guys, it's a part of who we are. And we have a phenomenal leader in this community right back here. I think we all know Dr. Figueroa. And so we're blessed to have River Valley, and we're doing things together collectively how we can best meet the needs of that community and that population, and it's not going away. So again, we're fortunate we can do things together. Obviously, housing. I don't know how many times you guys talk about housing, right? We got great things in the Habitat for Humanity. We got some other exciting things that are going to be coming forward after presenting to the board next Monday. So ways that we can help and participate, certainly in the housing and ultimately the food insecurities, things that we're doing there. So those are 3 things that we kind of determined here is based on those social determinants. Where do we want to partner? Where do we want to put some of our resources? So you can read down below some of those areas. I know you guys have been involved with the VOA. Certainly we got the Habitat for Humanity. We got other initiatives, but very grateful that we're able to do that and work with those various not-for-profits. Last Thursday, myself, Gavin, others, were able to, Debbie, present to 18 nonprofits here, a lot with those social determinants, where we awarded $280,000 to those not-for-profits, the ways to partner with them. And so again, that's just another small way. So a lot of things that we want to do. We're grateful that we can do these things. I see Tim and others and how we can partner and be highly visible, whether it's through the chamber, through the city. And so we certainly consider that an honor to be a part and certainly a valued partner throughout the city and county. So the last couple slides, I promise I'm almost at the end here. I mentioned about Health Force Kentucky. Hopefully you've seen, I know I've seen a couple of you. I know Commissioner Glenn and others, I know Mayor and others who have been on one of our 2 mobile units. Those were built right here, and certainly in Bruco, just not too far down the road. But the technology and what that's done, the excitement, we've been in front of 11,000 high school and junior high students so far, 11,000. Everybody knows Bart Darrell. Bart kind of spearheaded that. We're in a transition mode, but obviously the construction's happened in the old business center. It's going to be 38,000 square feet, 11 simulation labs. I can take my OR, actual OR, I can translate that, put that into a simulation lab. So staff are coming out, they're going to see exactly how that OR is configured, how it operates, and so it's the first of its kind. I mean, it'll be touchscreen walls, and so it's going to be exciting to see what happens. But again, between that, the mobile vans, when I went to the Representative Miles 3 years ago, we know workforce was hurting all of us, affecting all of us. I said, you know what? Not only we got a challenge, but we got a solution here. We pulled the 9 schools, the colleges together. I shared this with you in the past. Here's what we're going to do. We're going to take it up to Frankfurt, and sure enough, we got a grant for $38 million. So we're fortunate. I think we're going to just see the fruits. And I anticipate some of us who come through this Innovation Center future, this will be our future physicians. And it's going to be exciting to see a decade from now what really evolves from this. So this is some of the cutting edge things we're doing. Health Force, obviously we want to grow the AI. So a lot of things that we want to do certainly on the horizon. And so more to follow around that. So the last few slides here, I'm just going to show you a little bit kind of the state of the union, what's happening with healthcare. And I'm only going to hit a couple of these. So this is kind of an expert group that we work with, and they're the leaders, kind of economists and kind of predictors, and they understand what the future is. And so a couple of these things I just want to share. Look at the statistics. And some of these you read, but this is most recent. So increase in prevalence of obesity among young adults aged 20 to 44 years between 2009 and 2020, an 8.2% increase. Again, and so some of these are just statistics, things that we have to do to help promote and wellness and all those things. Look at increase in new cancer cases among patients less than 50 between 1990 and 2019, a 79% increase. I mean, these are staggering numbers, but these are things we want to do, and so that's why preventive care, wellness care, all those things that we're trying to do is we want to do our part and certainly affect these numbers in a positive manner. And these are just some others, but if you see where it's saying it's a sicker, younger population, and if I had Dr. Dufresne and others in here, the folks that are coming in, they are sicker, a lot more comorbidities, a lot of different reasons. We don't have all the answers, but the population, I believe, Dr. Dufresne, we've said they're sicker at a younger age, are they not?
Younger age, 20 to 40, all of a sudden we're seeing cancer rates skyrocket and other conditions, and they're really trying to figure out why.
Yep. So again, those are things we're trying to learn. We're great. We got the right physicians, but we're trying to solve for that and certainly do our part. Likewise, as I shared with you about the trends, what's happening kind of in hospital utilization, we know hospitals just aren't, inpatient. There's a lot of reasons for that, right? We can do a lot more advanced therapies, outpatient stuff, insurance, a lot of factors. But you can look and see what's going to happen here in this prediction these next 10 years between 23 and 2033. But you're going to see in that age population from 0 to 64, an 8% decrease in inpatient. As we move into the outpatient, I said 11% increase and so on. But look and see who's going to be the ones in the hospital, because we're living longer, but really most of the growth in the inpatients can be that 75 plus. You can see 52%. Likewise in the outpatient, about 65%. So those are the things we're trying to do to figure out how we can best service those ones, particularly in the outpatient. And I think AI will be a part of that. I think you'll see at-home type of healthcare, at-home hospitalization. So a lot of those things are on the horizon. It will definitely look different 5 years from now. And we want to make sure we're positioned as we have the right pieces in place that we can adapt, and we can certainly incorporate those things when they come about. Utilization will pressure an already poor patient outlook. The reason I just use a couple of these, and so you look at this, here's what's kind of talking. So I feel like we're really blessed with the number of physicians and access and things we're focused on, because sometimes unless you're out in these other communities, and I came from the big cities, so we just think the big cities, the Orlando's and Nashville's, not the case. Without naming, there's a couple of those specialties. If you go try to get a new patient appointment for some specialties in Nashville, you're 4 and 5 months out. But just look at right here, shortage of providers. There's a lot of reasons for it. I can sit there and tell you all the reasons for that. We don't have enough being produced. This is a decade in making. Government cut a lot what they call the GME slots. So we have less primary, less specialties, and so with an aging population. So again, it is what it is. Increasing patient demand, so it's kind of that perfect storm. And then certainly a lot of the increasing costs and elsewhere. But the one I want to share is just the one that says, look at that, 26 days. So the simple indicators are saying right now, the wait time for a new patient physician appointments in 15 of the largest cities in the U.S. is 26 days. That's your wait time. And so again, we strive for that 14-day. We do a great job at just kind of sharing what's happening in other parts, and we validate that, and that's truly the case. Here we go. Next one, just quickly just to share with you what's happened. You guys have heard about some of the payment reform. We know what's going on. We're pretty close with Congressman Guthrie. Certainly we know what's happening. Obviously Medicare, those who understand Medicare, we're moving more to this Medicare Advantage platform. We've now surpassed here locally greater than 50% of that. Obviously that's got its own issues that we're working through, but again, we're working through that. But in addition to that, you can see what's happened to the commercial. So the business, the private business, and the other things that we're seeing, we have a 5.6% decrease. And just in simple layman terms, we do better from a financial standpoint, just in the commercial than you do in government payers. That's just, that's right or wrong. But you can see that's a 10-point, 11-point swing. And so again, that's just creating some hardships, and that's why you read things with health systems throughout the country. Like any business, it just makes it more of a challenge. So we have to make sure we use our resources, do the right things for the right reason, and just gonna have to navigate through it differently in the coming years. So again, just a quick slide for you. And last slide here. Healthcare is really easy. Everybody gets in healthcare and says, you know what, I don't know what's so hard about this. Why can't we do this? So this is just a couple examples, and I'm just gonna leave you on the one right here. Walmart, hey, we can run Walmarts, we can run anything, and that's not picking again, because I've got several friends who have done it through others, even trying to get in the health system. But you saw Walmart announced plans to close all 51 health centers across 5 states, as well as its virtual care services. You can see their little quote there at the top. What's it say? The challenging reimbursement environment and escalating operating costs create a lack of profitability that make the care business unsustainable for us at this time. Again, and so I'm just showing folks who understand supply chain, who can do things at cost. It's a complicated business. A lot of them are. We're honored. We're doing the State of the Union. We're healthy. We're doing good. Does that mean sometimes we have to make tough decisions? Absolutely. But again, we're trying to do the right things for the right reason. I've got a great team behind me. I've got a great board of 16. But again, we know the importance of healthcare, not just the economic impact, but we're all going to need, our loved ones are going to need it. And I want to make sure you have the reassurance and have the trust when you go to the ER, physician, primary care, whatever else, that we have the best health care possible throughout the state and throughout this region. And there's no reason we can't do that. I know sometimes we challenge, we say we're going to be the next Cleveland Clinic or wherever it may be. There's nothing preventing us, guys, for the things that we can do. We can do it as good as any of the big cities around. But what I like about it, we're caring for and about the people who are our next door neighbors. I hope we go a little bit further and roll out the red carpet and go the extra mile, because we're caring for our neighbors and our loved ones. So again, I appreciate you, appreciate the support. You guys have always been very supportive of Owensboro Health, with me personally, my team. But again, I hope you guys know, and Mayor knows this, reach out to me anytime. And I tell you, to anybody here in the community here, you guys know that. This is our hospital. This ain't us. We're in this together. And the only way we're going to continue to thrive and do the great things is we work together. We found that out. Trying to do this in a solo in the vacuum, we're not going to be very effective. Does that mean sometimes we're going to make tough decisions? Absolutely. But again, thank you for the honor and the privilege for us to be able to serve you. And we take this role very, very seriously. So thank you for allowing us to be here tonight. Sorry for being long-winded. But again, we enjoy what we do. Thank you.
Thank you, Mark. Any questions from the group? Mr. Glenn?
Last time you came before us, or the last couple of times, Mark, you've mentioned a shortage of nurses and you've had to rely on travel nurses. How's that going? Because I didn't hear a specific comment about that, although.
Absolutely. Yeah, great question, Commissioner. Yeah, it's definitely decreasing. Obviously, we have some in pockets in certain areas where it's just short. We think that we're definitely moving in the right direction. So our travelers in general, whether it's nursing, and you may have one in ultrasonography, you may have some, but yeah, our trend is down significantly. I don't want to say, Russ, you probably have the exact numbers, but again, it's definitely moving in the right direction. Yeah, so to give you an exact number, but I can tell you where it was at one point in time, up to 9 to 10% of our nursing workforce were low single digits. And my hopes are, is that Innovation Center, I look forward to the day to say, you know what, quit producing too many nurses, we got too many. I'm looking forward to that day, but right now I think we're moving right. As I told you, OCTC, their enrollment was up 17% this past fall. Dr. Scott Williams said, you know what, what's happening right now are occupational, ultrasonography, but this is the 9 universities working together, but we are up considerably, and so we have a great retention. I know U of L, in their they had 25 students in the last fall. We attracted, and we got 24 of those 25. So again, we're doing a great job as we do interns, externs with them, but we want to create that environment for them so they will stay with us. So, but great question.
Okay, my other question is, with the bloodletting that's going on in Washington DC to the CDC, the NIH, and now the appointment of an anti-vaxxer, what are you guys going to do to continue to promote vaccine use along with the health department in our state and in our community, since we're obviously going to be swimming upstream, plus the bird flu epidemic, which any day now will contract into humans, and that'll be our next COVID, and you'll have to deal with that. You guys do great work. I have confidence you'll handle any challenge that happens, but I'd like to hear your answer, because healthcare isn't, nationally looks like it's about to go in a complete crisis given the direction we're going.
And that's why I bring these smart people with me. Hey, Dr. Dufresne, need your help.
Sorry. You guys should tag each other like wrestling.
So really, the drive for vaccination really comes from mainly our primary care offices, but even for myself. So I'm a liver specialist, and I promote getting hepatitis B vaccines all the time. So luckily now you get them in childhood, and our incidence of hepatitis B has plummeted. You look worldwide, it's still the #1 liver infection. Liver cancer is the #1 cancer worldwide because of it, but in America it has really dropped significantly. So you go to your primary care office, they're going to talk to you about, your flu vaccine, your COVID vaccine. We go to the pediatricians, and they're, setting up the vaccines. It's people's choice. Nobody's forced to do it, but we really promote it because we know that's the right thing to do.
Well, I'm just worried about federal dollars. If you lose
Right.
federal dollars because you advocate for it, that becomes problematic because you have a
Yes.
business to run, and I
Yes.
understand
Yep.
that.
Yep, thank you. Great question.
Okay, thank you.
Commissioner, real quick, just so you know, just like us, we're continually trying to educate. We actually met this afternoon, so Nancy Galvani, who's the president with KHA, Kentucky Hospital Association, she was in town, so we talk. Obviously, we work a lot. She represents a lot of health, and so obviously we're fortunate to have Congressman Brett Guthrie. You guys know his new role, and so the chair of the House, the Energy and Commerce, right, which healthcare is underneath. And so Brett is a great friend for all of us. We know that he loves his communities, and a guy who deeply wants to make sure he understands to do the right thing. So obviously there's a lot of education. They're flying in, we're flying in, but a lot of things that we can do, certainly with Congressman Guthrie, to make sure he's well informed. So thank you.
Commissioner Maglinger,
Thank you, Mayor.
you're welcome.
Our community's grateful to have such a strong community partner as Owensboro Health. Not only taking care of the health of our community, but the collaboration in local health care around here and supporting local profits and local businesses. Thank you very much for all your hard work. It's amazing.
It's a privilege to do it. Thank you again.
Commissioner Sanford.
Thank you, Mayor. Mark, that was a great presentation, and I like what you said about collaboration, because around Owensboro, sometimes that's a hard thing to do. It's been, in the past, people haven't collaborated, and that's good to see that you're doing that. Very impressed with your presentation. To be a great business, and you gave me all the high points, what's one weakness that you think you guys have that you want to work on, that maybe all y'all talk about? We want to get better at this one thing. What would that be?
I mean, ultimately, we always want to be the best from a quality safety. I understand, because one error, one wrong mistake is too much for us.
Yeah.
That's why we have something called Target Zero, and so our intent is to reduce every single infection, every type of thing. So obviously, that's always going to be at the forefront. I think somehow it's building the trust. I still think, and quite honestly, and healthcare is built on trust. I still think there's a lot of folks at some reason, right? It's on us. Is why I feel like I got to go somewhere else. And I say this carefully. My years in Bowling Green, my years in Nashville and Orlando, sometimes we're perceived it's the bigger, better syndrome. Is I got to go to the bigger city to get that. If you think about the common thing, right? We got the same physicians. You're getting the same training. The people who are going whatever the city. Our nurses are getting the same type of training. We got the same technology. So I'm trying to understand, what is it? So then if we give that extra attention from a patient experience, what is it that prevents, or what? Because again, I'm saying this very carefully, there's complications. So again, I've been in the biggest health systems with HCA in Orlando and elsewhere, guys, level 1 traumas. We have mistakes. We don't shy away from them. I can tell you that I call patients routinely, and there's something wrong, and say, what can we learn from it? Though they don't happen all the time. But again, I think it's the trust. Commissioner, is how do we help us to tell our story better?
I think you touched on it earlier about getting people that have had a good experience and putting that out there as much as you can, because people are going to talk about their bad experiences. Everybody likes to complain, and that's just human nature. But I think getting positive messages out, and I think you're working on that. I think that'll help you immensely.
We are.
But I appreciate everything you do, and
No,
thanks for
great
coming
question.
in tonight, and thanks for everybody else that showed up.
Thank you. Thank you.
So I'll give a testimony if you want me to.
Yes, sir.
My friend Dr. Dufresne sent me to Dr. Ben Smith for a pain that I'd had for maybe 15 years. It was really causing me to not be as active as I want to be. And you wouldn't think that the staff would be a real happy place to be in, because everybody that comes in there's got pain. But he did an ablation, and he made my life better. So I can tell you, you got some talent there, and I appreciate that, Fran, for sending me the right place. I appreciate it. So, okay. Anybody want to adjourn, or are we still going to keep going?
Sorry.
Thanks, Mark.
Thank
Thanks,
you.
Mark. Appreciate
Our
it.
privilege. Thank you, guys. Thanks so much.
Okie dokie. Next item on the agenda, Human Relations Commission update. Becky Brandel, Executive Director.
Hello.
Please state your name and address for the record.
Becky Brandel, 1475 Highway 657, Lewisport.
What's this?
Waiting on a clicker. Actually, I noticed, Mr. Stanford, you have 2 bottles of water. Could I have one? And since Mayor says he's already ready to adjourn, I will move as quickly as I can. Thank you all for having us. I also want to thank, we have quite a few board members represented tonight, so I have a lot of people making sure that I do a good job. So I appreciate you all being here, and I appreciate the time. So we just want to take a little bit of time to highlight what the Owensboro Human Relations Commission did in 2024, and then looking forward to 2025, what that's going to look like for us. So we have 3 main areas of focus that our organization focuses on. Those are events, trainings and programming, and inquiries and cases. So I'm going to give a little bit of detail about what that looked like in the past year. So number 1 are event highlights. So we really strive to participate in events that focus on specific things within the community. So those things that we like to focus on are events that strengthen relationships between racial and ethnic groups, celebrate cultures that are represented here locally, and events that provide resources and education for at-risk populations. So we were able to attend quite a few events in 2024. Many of those events will continue into 2025 as well. Our trainings and programming that we offer are primarily focused on human rights and how individuals can make sure that they have access to their human rights, and then also how businesses and organizations can uphold those rights. So we offer free trainings to local organizations and nonprofit businesses. And then we also really try to provide trainings and opportunities that deal with interpersonal issues. So it's easy to just talk about the laws, and that's very black and white, not a lot of gray area there, but interpersonal issues that occur within organizations and businesses takes a little bit different kind of approach. So a lot of the trainings that we're contacted are in direct response to some type of issue that that organization is seeing. So we try to customize those trainings to the organization that we come to, and we meet with them beforehand to make sure what type of issues that they're focused on, issues that they've seen within their staff and within the people that they serve, and then we try to directly assist them in coming up with ways to handle those. I do want to highlight really quickly, and that's what our little pictures are from, my absolute favorite thing that I get to do at my job with OHRC is to go see the girls at Girls Inc. They are absolute spitfires, so much fun. Emily and I usually tag team those because whenever we leave, we literally are exhausted. One of our board members actually deals with OSHA violations, and she goes there with Junior League as well, and said that she has a tracker that tracks volume levels and lets you know basically when it's above OSHA standards, and it literally happens within Girls Inc. But they're so much fun. The programming that we do with them is really focused on self-esteem, self-care, self-respect, anti-bullying, and basically different ways that as they grow older, they can learn how to be civically responsible and be, just great members of the community. So we have a blast with that. We would love to expand that into other local youth organizations in the future. One thing that we focused on in 2024, these are a couple of cute pictures for you guys to see. So Emily Clark, our development director, really helped us focus this year on ways that we could give back directly to the community. So we were able to do a survival kit drive for the local homeless shelters. We were able to do Sleep in Heavenly Peace. And then in 2025, we've actually tasked all of our volunteer board members with coming up with their own. So they'll select a month in 2025, and they're responsible for coming up with that community give back program. So we're really looking forward to see what they come up with. And then lastly, inquiries and cases. So this is kind of what we're known for as an organization. So we receive inquiries either by phone, our website, or honestly, we receive a lot of walk-ins here directly at City Hall. Robin downstairs usually just gives us a little holler and says, "Miss Becky, there's somebody down here that needs to see you." And those inquiries honestly can range really widely in what those individuals need. So specifically, it is our job to assist individuals that have experienced some type of discrimination and finding out if that discrimination is going to lead to a case that would be filed with the Kentucky Commission. But we also receive intakes about landlord-tenant disputes, just workplace issues, and honestly, sometimes just someone that's really struggling and they're looking for somebody that they can talk to about that struggle. So a lot of times those inquiries will lead to referrals. So it's really important for us to maintain partnerships with our local organizations that provide additional resources for those individuals that are struggling. But our role in that intake process, I'm going to skip to this next slide because this is relevant. So a lot of times people have a hard time understanding the difference between the Kentucky Commission on Human Rights, which is located in Louisville, and then our local Owensboro Human Relations Commission. So the Louisville office is obviously very heavily funded, and they have a large staff. So they are tasked with the complete process of taking care of a discrimination case. So they have legal enforcement authority to address those human rights violations. They have investigators on staff. They have the legal department to take that all the way through a court hearing if necessary. And then they also have education and outreach staff members. The Owensboro Human Relations Commission, we have a much smaller staff and a much smaller budget. So we prioritize education, community engagement, and then that proactive relationship building. And last year, I know that, I think it was Commissioner Bob Glenn asked us specifically about some demographics. So I did pull some information. This primarily focuses on racial demographics, but then also I had reached out to the International Center. As all of you know, our refugee population has grown a lot in the last several years. And the data that was available online was only up to 2022. So I actually reached out to Diane because I was interested in the last 2 years as well. So I do have these numbers. I do not have them in the slide, but I can provide them at a later date. So since 2018, we have had a total of 923 refugees relocated to the Owensboro-Davis County area. Primarily, those refugees came from the Democratic Republic of the Congo, Burma, and Afghanistan. We do have other refugees that come from other locations as well. So as our population and our demographics change here locally, each of those different cultures and, whatever circumstances those individuals find themselves in, will present different challenges, but overall across the board, we are seeing, and I know you all are seeing, affordable and safe housing as a very big issue for our local community members. So something that we are focused on and actually partnering with some other local human rights commissions. So we've partnered with reps from Bowling Green, Paducah, Henderson, and Hopkinsville, and all of those human relations commissions locally are seeing the same thing that we're seeing, an uptick in landlord-tenant disputes, something that is really difficult for us to address because there's not a lot of clear guidelines. There's a lot of gray area in the law. So the benefits of IRLTA is something that we would like to discuss with you all more in depth in the future. We're doing more research regarding that, and again, partnering with those other local organizations. So really quickly, these slides give a little bit of information specifically about IRLTA, but basically the goal is across the board to create fairness in rental agreements. A lot of people don't see the side that protects landlords, but the eviction process is way more clear under IRLTA. This one is big to make sure that properties are safe and livable. That is something that we struggle with here locally. And then also to provide tenant protections under that. So again, that's something that we want to, oh, I went too far, didn't I? Yep, there they are. That's something that we want to meet with you all individually. And again, we have met with some of you to specifically discuss IRLTA. Questions were asked that we didn't have all the answers to. So that is a process that we really want to be fully prepared before moving forward, but it's something we'd like for you all to be open to the conversation of. So I want to tell you guys really quickly about our board of directors and how we function. So we have all three of our executive board members today. So board president is David Kelly, our vice president is Lee Knuckles, and our treasurer, Anita Jackson. So that is the first of our committees. We have an executive committee, and then these are the other committees that we have established on our board of directors. So advocacy is primarily focused on those human rights issues, specifically focused on IRLTA at the moment. A new committee is marketing, which is mostly led by Emily. And that group is really focused on how we are perceived in the community and by the community, and also how we dispense those educational information out to the community. And then fundraising and events is obviously tasked with a pretty difficult job. They're focused on raising funds to support our mission, managing volunteers, and then also event planning. And then finance probably has the hardest job of all, because they are tasked at looking at our budget, deciding what type of role we can perform in the community based on those dollars and making the most of them. So definitely the hardest of all. And then as we look into 2025, I really want to express the focus, and we also are taking time in these next few months to really be honest and responsible with ourselves about what our role and our goals should be moving forward. I think it's easy for any organization to have a grand plan or a long list of things that they want to do, but we want to approach that in a very responsible way, in a very realistic way about what we're able to accomplish in the community. But we are committed in 2025 to listening to and advocating for voices, and not just some voices, but all voices. Making education regarding human rights and how to uphold them accessible for all people. That's why we really want to maintain that the trainings and education we do is free. And then partnering with and supporting other local organizations. So mentioned earlier that collaboration is a little bit difficult sometimes in Owensboro. I have found in my time here that a lot of times there's maybe some turf wars or ego or pride that gets in the way that keeps organizations from working together. That's something that we can't afford to do because we do have a small staff, we do have a small budget. The only way we can really expand our efforts and our value is to partner with other organizations. So we're committed to that. And then lastly, one thing that we wanted to point out is our organization was first created in 1972 by a city ordinance, but that city ordinance has not actually been revised at all since 2001, so that's a really long time. So we would like, looking towards the future, to possibly work with our city commissioners and with the mayor to see what that city ordinance, if there's maybe some revisions or changes that need to be looked at moving forward. And then this is maybe a little bit non-traditional, but because we are housed in City Hall, I get to work with and see a lot of city employees on a regular basis. So I wanted to take a second to thank some of the individuals that kind of make OHRC possible. So first, Abby Shelton is my office neighbor, and literally she helps me in big ways, but also if I have no idea who to ask for something, I knock on her door and Abby points me in the right direction. Finance department, huge. They're extremely helpful in helping us take care of all the money issues. HR and payroll, just our regular everyday taking care of our staff. They are fantastic. And then we want to give a special shout out, hopefully he is able to hear this, to Ken in the tech department because we love Ken. He's wonderful. He's always willing to be, super helpful, but he's also just a really cool guy. So we want to thank the city of Owensboro for hospitality. Without the opportunity to be here in City Hall and all of those things that come from the staff, it would be very difficult for us to perform our mission. So thank you so much.
Could you introduce any more of your folks that are here with you today?
Yes, absolutely.
'Cause
So
since we appoint them, so it'd be nice
right
to put
now you can put faces to
face
names.
with a name.
Actually, if it's okay, can I have them introduce themselves?
Oh, yeah, $5 each.
Leaves refusing. Okay. Do you want to come? Yeah.
I'm Lee Knuckles. I've been on the board for almost a year now. Started vice president in January, so just looking forward to it. Yeah, thank you. Becky's in trouble now.
Wasn't my idea.
Good evening. My name is Dr. Eunice Taylor. I've been on the board for several years, former president, and I'm still serving on the board because I love my community, I love what I do, and I love working with these wonderful people. So thank you.
Thank you.
Hello, I'm Dava Kelly. I've been on the board for a year in March, and I just been appointed board president in January. So I used to work as an employee for the Human Relations Commission probably, over 10 years ago. So it's nice to be back in some form.
Thank you.
Good evening. I'm Anita Jackson. I'm OCTC employee. I'm newly on the member. I just got elected the treasurer, and I'm looking forward to working with everybody and seeing great things happen within the community.
Thank you.
I'm gonna follow directions. 728 Sycamore Street. Rafe Buckner. I just been appointed. I've been to one meeting so far, but excited to be a part of this.
Thank you. One final question, please.
Of course.
Does the county contribute to your budget?
The county does. So I think we've actually just looked at that recently because this year we are requesting a higher dollar amount. But it has been a $10,000 for quite a few years.
Okay, I thought they did. I just was trying to get it in my head.
Yes.
Thank you very much.
Of course.
Appreciate you. Next item on the agenda, 4C, Owensboro Police Department, Annual Report. Deputy Chief J.D. Winkler.
How are y'all? Thank you for the opportunity, Mayor and Commissioners. I'll be quick, I promise. All right, thank you, sir. The city manager already told me that he would let me know if I needed to speed up a little bit, so I'll get with it if I need to. First slide up, our calls, 36,496 calls for service, 12,041 traffic stops, and supported 50 special events, including Friday after 5. I'd like to highlight the special events just primarily because there's a lot going on in Owensboro, and I appreciate that, and it drives me crazy every time somebody says there's nothing happening in Owensboro because we have a lot going on here. And we enjoy that, but that does get challenging at times because our officers that are covering the special events have to do it in addition to covering the calls, covering their investigations. So it is something that is added on to those calls for service, and I'm proud of them for the amount of times that they step up to cover those. Sometimes events, 30, 40, 50, even 60 officers are required. So we keep on plugging away and getting it done. Our uniform crime stats, Part 1 crimes, and basically the FBI categorizes Part 1 crimes and Part 2 crimes. Part 1 crimes are your more serious crimes. I guess they view them as that, but involves your murders, your rapes, with the violent crimes, aggravated assaults, with your Part 1 property crimes or burglaries, larcenies, vehicle thefts, and so on and so forth. Overall, with the Part 1 violent crimes, we've stayed pretty steady with what we had last year. Over the past 5 years, there's been a downward trend, starting around June of 23. We saw a pretty significant drop in our Part 1 violent crimes, and those have kind of stabilized. Part 1 property crimes, they're down slightly with our burglaries and our thefts. Overall, between the two, we're down about 7.28%. I do want to say when it comes to our crimes reported, our officers do a great job, and they're out there working hard to keep these numbers low. But we don't do it alone. Nothing happens in a vacuum. Our community involvement and the help that our community gives us is pretty important. And I know this is one of the stats that I don't have in here that's from a Part 2 crime, but particularly gun thefts. I was looking at those numbers, and gun thefts are down in 2024, 41.25%. That means that our community is listening, that our citizens are paying attention, they're securing those firearms, and they're helping us out with that, and we certainly appreciate it. Our clearance rates, with our investigation unit, our Part 1 violent crime clearance rate, 73%. You can see there that the state is 50%, and the national is 41%. We strive for 100%. Our folks work hard to get at that number. We're pretty proud of that number, staying well ahead of the state and national. Same with Part 1 property crimes. We are ahead of the state slightly. We're looking to improve that number and keep climbing that one up. Moving on to some of our criminal investigation stuff, and I just wanted to highlight some of the things that our folks do on a daily basis. Our digital forensic unit, 183 cell phone downloads, 13 computers, 51 digital media devices. Officer Brown, one of our retirees that came back that works in that unit, and he helps us out a lot. He helps out a lot with the internet crimes against children cases and our narcotics cases, and that involves a lot of time going through those phones, going through those devices. I'm not a technology guy, so I appreciate having some folks that are around with that. Speaking of the internet crimes against children investigations, see there we opened 50 investigations, 12 arrests, 178 charges. From my perspective, I was a narcotics detective back in the day, and I have a lot of respect for the guys that work these internet crimes against children cases, and are willing to sit down and go through thousands and thousands of images to protect our children in this community. And they put a lot of work into it. Just one of these investigations alone can encompass dozens of search warrants, hours and hours of going through digital media and locating IP addresses and following up on every lead to bring these folks to justice. Our street crimes unit, see there I have 62 federal indictments, approximately 270 pounds of methamphetamine seized, 23 pounds of cocaine, 100,000 fentanyl pills, and 1 pound of heroin. Our street crimes folks have worked hard, not just last year and this year, but in previous years, with our focus on targeting the individuals that are going after the most vulnerable in our community. The focus for addicts, I think that there's a difference between addiction to control how they were using people to traffic. 25 administrative investigations. 18 of those were external, and 7 were generated internally. The internally generated complaints, myself or the chief or Major Staples will, if we identify something that needs to be investigated, we'll look into it and direct the professional standards unit investigator to look into that. Out of those 25 internal investigations, there was 100 possible administrative charges that came from that. Basically, what will happen if there is if there's an internal complaint or there's an external complaint, internal affairs will look at every aspect of it. If, for example, if the officer was speeding on their way to jail or something like that, something additional. So there may be more than one administrative charge that comes out of that. So out of all of those administrative charges, we had 8 non-sustained, 55 exonerated, and 37 sustained. We also have our use of force statistics reported there. Again, I think it's important that we relay this information to our community. You know, I know when I get doing to researching things, there's not very many departments out there that do report this type of stuff to their citizens, and I think it's important to maintain that public trust that we continue to do so. Some of our accomplishments, you know, the big one that we appreciate y'all for is the graduation of OPD Academy Class 1. 9 officers, I think they're scheduled to, they're still in training with their training officers. They're scheduled to come off March 16th, and we really appreciate y'all's support. Not just y'all, but the city manager, the chief, and all of our folks at the department that put in the work to make this happen, because it was a lot of work to get to this point, and I think that it's going to have a significant impact on our community. Last slide I'll go over is just some of our accomplishments and some of the things that we've done, and I have the list there and some of the pictures. Our community is very important to us, and I think that how we engage the community is incredibly important in maintaining that community trust and letting them know that we care. I know the one thing I would like to point out, that top right-hand picture, that's our Citizens Academy. I strongly encourage any of our citizens to sign up for that and come and learn about your department. It's a couple hours a week, and it's not just for people that may like the police department or may have a friend that works there. I encourage anybody that wants to know more about what our people do. It benefits them, and it benefits our officers. Our officers enjoy engaging with their citizens and telling them about what they do. So I would strongly encourage anybody to consider that. We'll be coming up later in the year. And I'd be happy to answer any questions. City Manager, hopefully I wrapped it up quick enough for you, sir. And
any questions?
I just got one very quick one.
Yes, sir.
I'll give you one.
Just that's all I need. So you did a really good job, Chief, of talking about the guns being stolen, and we're reducing that number. Do we have an organized campaign? Because I go to these neighborhood alliance meetings. I know you do too. You're there. God bless you. You're there all the time. And you hear these people, they stole the gun out of my car. So have we ever given any thought to having an organized media campaign to say, don't leave valuables in the car, including guns? Because it's like the reaction is always so priceless. Oh, I didn't know I shouldn't leave my gun in the car. No.
Yes, sir. And we do put public service announcements out occasionally. The thing about it is, and it's like any of the public service announcements, if we do too many, people just ignore them. There's a lot of stuff that, like you say, the neighborhood alliance meetings, and that's one of the things that our officers, another thing they do is we get our officers to them meetings. I try to go to as many as I can. And just telling our citizens and telling our community, this is the type of stuff. Don't leave your gun in the car. I support gun ownership, but responsible gun ownership is important because it's not always. We have sometimes people from out of town that come to Owensboro for events. They'll leave weapons in cars that get stolen. Locking those up. The safest place for a gun is to either be in a safe where nobody can get access to it or on your person, and that is something that's very important, sir.
Thank you, Chief, and thank you, Mayor.
You're welcome. Yeah, I locked mine up, but I can't find the daggone key now, so. Oh, well. Any other questions?
All right, thank y'all.
Great job, JD. Okay, next item on the agenda, Owensboro Fire Department Training Update. Mr. Corey Gant, Battalion Chief.
Making Josh go back and forth with the clicker for us.
We can't afford but one clicker up here.
Angela has the other one.
Oh, Angela's got it.
All right, good afternoon. My name is Corey Gant. I'm Battalion Chief of Training over at the Fire Department. I'm here today just to kind of give you guys a recap of what we accomplished in training with the Owensboro Fire Department in 2024. So just to kind of start off, just some basic stuff. The department itself accomplished over 22,000 hours of training. We have 100 people, so you do the math, that's about 220 hours per person last year. We have finally completed our training / burn tower. We got some use out of that, and I'll get into that more here in a little bit. We did a lot with several of our community partners around town when it came to training and different things in the community. And just to piggyback off of Deputy Chief Winkler there, we completed our in-house recruit academy as well. And as part of the training division, we onboard all of our new employees, and I'll get into kind of some of those details here in a second. So we talk about our training hours. As part of being a firefighter here in the state of Kentucky, we receive a training incentive every year. To get that, we must maintain at least 100 hours per person every year. Again, going back to that 22,000 hours, we are well above that 100 hour per person. And so we did have 100% completion in that this year. And we also working to keep our training in line with the Insurance Service Offices, or ISO, as it's usually called. They have stipulations and standards that they set as what they expect for you to achieve on an annual basis for your training. When we lay out our annual training plan, we take all that into consideration, and we're working to strive to gain all of our points in that field as well. These are some of the trainings that we actually got to participate in this year. As you can kind of see the pictures. The top left, we have a car prop that we get from the State Fire Commission that's propane fuel that we can work off of. That big red trailer underneath of it, we refer to that as the Fire Blast trailer. It's a Class B propane prop as well that we were functioning doing basement evolutions out of. Next to it, you'll see the guys on the ladders next to that yellow prop. They have another trailer at the state called a Man versus Machine. Basically, it's focusing on people getting stuck on fences, getting stuck in different machines, industrial complexes, things of that sort. This was the actually fence impalement prop. That's a mannequin that has a piece of rebar stuck through him, and we are working to stabilize them and get them off of it. You can see we got into the ice back in January of last year to do some ice training. Above that, you see us doing some hands-on training at the sports center in the parking lot. We also completed a 40-hour trench class. The guys that are down there, you can see the 4x6s there by their heads. That's the trench class that we did with Ohio Township and Evansville back in April of last year. Next to that is training out at Rudy Mines in preparation for the bike races that they had back in October. All of our special operations teams went out there and did training on the Moody Mines trails to learn those. And there in the bottom right-hand corner, that's out at Station 5. We actually have some anchors that are built into Station 5 where we can do rope rescue training. So that's what they're kind of doing there. As I mentioned, we did finally get completion of our training in our burn tower. This is actually an actual burn from one of the rooms in the burn simulator. That's the second floor room. It really gave us our first time to burn and do live fire trainings in over 4 years. Our previous burn room was pretty much off limits because we'd used it so much over the years. And now that we're getting our new training center done, we were actually able to get into this, teach all of our guys fire behavior, fire control, and basically just build some real life scenarios. Get in there, fight fire, and do our job. I mentioned the community partnerships. We did several trainings with Davis County Fire, that fire blast trailer, the car prop, the man versus machine. Those were all in with Davis County Fire. Some of that stuff actually took place out at their facility. We did an event with OMU back in September where we simulated a car wreck where they had a lineman on one pole and a car hit another pole, and it simulated one of their linemen going into the to the electrical lines. We showed up. We did help them get their guy down, got the people out of the car, and air evac flew in and transported the patients. We were part of the Ghost Out in 2024 with Owensboro Catholic. We went out there and we simulated a car wreck, a drunken driving car wreck prior to their prom, just as a real life example of what could happen if you make some bad decisions. Again, that was with AMR, that was with air evac, and it was with Owensboro Health as well. And then finally, I forget to mention our colleagues across the room, OPD, we do a lot with them too. Just kind of piggybacking off of Deputy Chief Winkler again, the special events. We work kind of hand in hand and get to work with them a lot, and I will commend them. They do a lot when it comes to the special events as well. We did complete our first in-house recruit academy since 2021. Over the last couple of years, we've been sending our recruits to the Fire Commission Fire Academy down in Greenville. We are happy to be able to bring this back in town and do it here. I think that we really had a great program for myself and for Lieutenant Johnson, who's my right-hand man when it comes to training. We learned a lot this year, and we're looking forward to what we can do down in the future. We had 8 brand new recruits. We actually brought in 1 lateral as well who joined us for 4 weeks. He started in the middle of it. All 8 of our recruits passed all their IFSAC tests while they were in their recruit academy. That is something that's required of them to come off of their probation here at the end of their 18 months. So we're proud to say that they passed all of their written and their hands-on skills as part of that academy. 5 of the 8 are currently in EMT class and are expected to graduate EMT class in April. The other 3 already had their EMT, so we're working on getting them through that, and then we'll get them, they'll be good to go. These are some of the pictures of some of the things that we did during our recruit academy. We did some rope rescue training. You can see us doing some hose advancement drills down in the tower. We took advantage of old Station 3 before it was met its demise, and went in there, and that's the guy there holding the saw with the sparks. That was us cutting some of the metal doors in Station 3 before they demoed it. And you can just see just the multitude of training that we got to do, and that group really built you brought 8 people together. They aged from 22 to 46, and they really meshed really well. So we were proud to get them all through the academy together. And then also, as part of the training, we onboard all of our new employees. Yes, we had 8 brand new recruits in the fall, but we actually brought in 17 new department members last year. Of those 17, we had 11 new hires, the 8 recruits in the fall. We actually had 3 recruits in the spring, 2 of which went to the State Fire Commission's academy, and the other one actually had enough hours that we kept him in training for 4 weeks before we put him on the trucks. We brought in 5 lateral transfers from different departments around the state, and we brought in 1 former retiree who decided he wanted to come back. So that's our job. When we bring them back, the new hires, the laterals, we usually keep them anywhere from 2 to 4 weeks with us in the training division to just kind of get them up to speed on how we do things at OFD, and just get them acclimated to our department. So with that, kind of what we're looking forward to 2025, more live fire training. In March alone, we'll be doing the fire blast trailer again with Davis County, and we will be doing a whole week of live burns in the tower at the end of March. We want to continue to build our relationships with our community partners. We've actually got training scheduled with AMR in between the 2 live burns in March that we will be doing simulated extrication training. We're going to get some cars from one of our local junkyards, and we're going to work with them. One thing about becoming an EMT is you do like 1 day of extrication, then you never get it again. So they're going to come out with us. We're going to work through scenarios and work together on some different extrication drills. We're looking forward to having another recruit class. As of right now, our game plan is to start the Tuesday after Labor Day. Shameless plug, we are accepting applications right now, so if you're interested in joining us, please do so. And we're looking forward to getting that finish line and getting that completion of our training center and be able to use all of it going into the spring. So with that, I'll take any questions. And let me off easy. Thank you.
Elected officials, and we're very proud of both our police and fire department. Thank you all very much. Okay, next item on the agenda, city project list. City Manager Nate Pagan.
Yes, sir, Mayor, thank you. The project list is in your packet. I know I emailed a copy to you yesterday as well for review, so I'll just answer any questions. Nothing I'll highlight this week or this month, just answer any questions should you have them.
I have one. Can you update the Senior Citizen Center?
Yeah, that's a good question. There is an update to report. So that project was put out for bid, I believe, last month, actually in December. Those bids were opened 2 weeks ago, I believe, on June 30th. So the selection committee is evaluating those bids at this time. I think the plan is that the top 2 bids or top 2 proposals will be brought in for an interview process, and then hopefully have something selected by late or mid to March. So that is ongoing, Mayor, and hopefully we'll have a decision soon.
And secondarily, this tax increment financing stuff, maybe we ought to, it's pretty difficult to understand, for me anyway, so what do you think?
It is, Mayor. That's a good comment. So we do a brief report every month. It's kind of really, it just updates once or twice a year, though, truthfully. It is pretty complex. We've got some new commissioners over the last couple of years, so it's probably time that we schedule a presentation. Probably Angela will do that maybe in a month or two to kind of walk through, not only for commissioners and you, Mayor, but also for the public as well, to kind of detail how the TIF was structured and then what those projections were and how it's done in reality compared to those projections. It's been open and operational now since 2018, so there's enough data that is usable. So that's something we'll schedule for the next month or two.
Okay, thank you. All right, anything else? Sorry?
No, I'm sorry, nothing else for me.
Okay, good. All right, not good, but good. Item 6A, consider approval of minutes of February 4th, 2025. I'll make a motion to approve these minutes. Could I have a second, please?
Second.
Any discussion, additions, or deletions? Hearing none, all in favor indicate by saying aye.
Aye.
All opposed, motion carries. Thank you. Item 6B, consider board appointments. Police and Firefighters Retirement Fund Board closed. Ratify the election of Charles Hayden to a one-year term expiring December the 31st, 2025, and appoint Chief Art Elam to a one-year term expiring December 31st, 2025. Midtown East Neighborhood Alliance, appoint Heath Stone to a 2-year term effective February 18, 2025. Citizen Advisory Committee on Community Development, appoint Rafe Buckner effective February the 18th, 2025. So, motion to approve, please.
So
You already
moved.
do that? Second?
Second.
Any other discussion? Hearing none, all in favor indicate by saying aye.
Aye.
All opposed, motion carries. Thank you. Item 7, an ordinance, the first reading, there'll be no vote. Ms. Davis.
Ordinance 2-2025, an ordinance approving and adopting text amendments to Appendix F, Article 8 of the Owensboro Metropolitan Zoning Ordinance for the cities of Owensboro and Whitesville and Davis County, introduced and publicly read on first reading this 18th day of February 2025.
Thank you. City Manager, would you like to discuss this?
I will just briefly do a quick introduction. So this is first reading of a text amendment to the zoning ordinance. The Owensboro Metropolitan Planning Commission administers the zoning ordinance, and the OMPC Board approved this amendment at a recent meeting. Melissa Evans, who is the Associate Director of Planning for OMPC, is here, and she will provide a brief overview of this amendment.
Ms.
Yes.
Evans.
Thank you. The Owensboro Metropolitan Planning Commission met on January 9th, 2025, and recommended approval of the proposed revisions to Article 8 of the Owensboro Metropolitan Zoning Ordinance. The proposed revisions are related to Level 3 solar energy systems. So those are going to be your large-scale solar industrial-style complex energy systems that you would see. And these amendments were requested by Davis County Fiscal Court and sent to us. The proposed text amendments include an increase in setbacks for all equipment to perimeter property lines, residential structures, and county parks, updated screening requirements in regard to when screening shall be installed and how it is maintained, updates to the decommissioning requirements to increase the amount of a decommissioning bond and to require a decommissioning plan to be prepared by a registered professional engineer familiar with Level 3 solar energy systems and that decommissioning process, as well as requiring that plan to be updated every 5 years. And the last major amendment is to limit total acreage of prime agricultural farmland permitted to allow a Level 3 solar energy system as determined and tracked by Davis County Fiscal Court. You know, these Level 3 solar energy systems are going to require quite a bit of land. So, you know, comprising that amount of land within the city limits of the city of Owensboro is going to be quite difficult to do, and in the zoning classifications that they're permitted in. So this isn't necessarily something that affects the city limits of Owensboro, but it is within the zoning ordinance and is part of your all's zoning ordinance for you all to take action on.
Mayor, if I could just add a little
Sure.
context. So she's exactly right. This really has limited applicability to the city. It's the large-scale solar farms that you would see in a rural area. There's really not probably a piece of land big enough in the city that could accommodate this. However, the zoning ordinance is a joint ordinance between the cities of Owensboro, Whitesville, and Davis County Fiscal Court. So we adopt all of those changes, even though this particular one has limited applicability within the city.
Okay, thank you. Any other comments? Okay, since we're not going to vote on it, we'll wait and get you next time. All right, item 8, Ms. Davis, municipal order.
Municipal Order 2-2025, a municipal order authorizing and directing the mayor to execute an application for a Kentucky Transportation Cabinet Office of Highway Safety grant in the amount of $44,000, the proceeds of which will enable the Owensboro Police Department to provide overtime traffic enforcement during specific mobilizations within the city of Owensboro to enhance public safety. No cash match being required by the city. Read for approval on one reading this 18th day of February 2025.
Thank you, City Manager.
This municipal order approves a grant application for $44,000 to be used for overtime for police department traffic enforcement, such as the click it or ticket, speed weeks, drafts over, get pulled over, those types of initiatives. We participate in this grant program every year, and no match is required.
Thank you. Okay, I'll make a motion to approve. Could I have a second, please?
Second.
Any further discussion, deletion, or additions? Hearing none. All in favor indicate by saying aye.
Aye.
All opposed, motion carries. Thank you. Item 8D, please.
Municipal Order 3-2025, a municipal order authorizing and directing the mayor to execute an application for a Project Safe Neighborhoods funding grant through the U.S. Department of Justice in the amount of $30,000, the proceeds of which will be utilized by the Owensboro Police Department to purchase a new X-ray machine with hardware and software for the hazardous device unit, for which no match is required. Read for approval on one reading this 18th day of February 2025.
I'll entertain a motion to approve this, please.
Second. I apologize. I make a motion.
Thank you. Could I have a
Second.
Could I have a third? No, just kidding.
Second.
Thank you. City Manager.
And I have nothing to add on this one, Mayor.
Amen. Okay, all in favor indicate by saying aye.
Aye.
All opposed, motion carries. Thank you. City Manager items.
Mayor, first up, Angela Wattinger will present the January financial report.
Okay, bean counter.
All right, here we go, Mayor. All right, so for the month of and the 7 months ended January 2025, for those of you that have the financial packet, you can refer to page 3 for more detail. So for our first slide, for the month of January, actual revenues were $5,775,787, less than budgeted revenues of $5,823,101. This is a variance of $47,315 and is primarily due to lower property tax collections for the month, offset by higher net profit collections for the month. Our next slide is the general fund revenues year to date, January. Our revenues were $48,764,384, higher than budgeted revenues of $45,932,093 for a variance of $2,032,291. This variance is primarily due to higher net profits, occupational withholding, and insurance premium license fees. Also, I'd like to note that a portion later in the fiscal year of the property tax and net profits will be dispersed due to our tax increment financing and developer incentive agreements. Our next slide is the general fund expenditures for the month of January. Actual expenditures of $11,168,155 were higher than budgeted expenditures of $6,367,983 for a variance of $4,800,172. And this variance is primarily all due to a land purchase that we made in the month of January. For the 7 months ended January, fiscal year-to-date expenditures were $47,125,182, less than budgeted of $48,236,023 for a variance of $1,110,841. This variance is primarily due to the land purchase I mentioned earlier and timing and transfers, offset by timing and transfers to OMU and maintenance. And so for our last slide, you can see that the city's monthly revenues and expenses are up and down as depicted in this chart. The expenses reflected by red and the revenues depicted by green. You can see that the green is higher in the months that we have revenue collections, such as in the months of November and December, and the month of April due to collection and net profits. And the red line, our expenditures are typically higher in the summer months. However, you see it does shoot up here in the month of January. And like I mentioned earlier, that's primarily due to that land purchase. So if anybody has any questions, I'd be happy to answer.
Any questions, please? Okay, I'll make a motion to approve the financial report for the period ending January the 31st, 2025. Could I have a second, please? Thank you. Any further discussion? Hearing none, all in favor indicate by saying aye.
Aye.
All opposed, motion carries. Thank you. 9B, please.
Yes, tonight, the following personnel appointments for your consideration. For new hire probationary status, Edgardo Neves, probationary full-time, non-civil service appointment to refuse truck driver with Public Works Sanitation, effective March 3rd. For regular status, or those having completed their probationary period, Tyler Ballard, Paul Warren, regular full-time non-civil service appointments to officer with the police department effective February 14th. Timothy Chad Johnson, regular full-time non-civil service appointment to lieutenant with the fire department effective February 25th. Stephen Mueller and David Spalding, regular full-time non-civil service appointments to firefighter with the fire department effective February 26th. And Stephen Mattingly, regular full-time non-civil service appointment to laborer maintenance helper with the Public Works Street Department effective February 26th.
Thank you. I'll make a motion to approve these personnel appointments. Could I have a second, please?
Second.
Any discussion? Hearing none, all in favor indicate by saying aye.
Aye.
All opposed, motion carries. Thank you. City manager comments.
No additional comments tonight.
Communication from elected officials. Pro Tem.
I don't have any specific thing I want to say, but I do want to ask everybody as we prepare to go into this weather event, be safe out there and make good decisions for you and your family. And then number two, I want to thank our first responders who will surely be very busy over the next 72 hours, and our public works folks who will clear the roads and make things passable after the storm passes. And that's it.
Thank you. Commissioner Maglinger.
Yes, had the privilege to attend the Owensboro Chamber Day in Frankfurt, and got to meet a lot of our Transportation Board, the Justice Chief, meet with our representatives. Had a very productive day, anywhere from small business leaders to corporate leaders to nonprofit. And then ended up the evening with Governor Brashear and Representative Comer and Miles. So it's very proud to show off Owensboro to our Western Kentucky.
Thank you. You're our appointment to the chamber anyway, right?
Yes, sir.
Yeah, thanks for going. I've been there and done that. Commissioner Neesmith.
I just want to say to Corey that when you were speaking about your department, that they also do a lot of the little things for our citizens, especially one that decided she was going to the grocery the other morning at 6:30 a.m. And the one item that I wanted was 4 shelves above my head. And I weighed the idea of climbing the shelf and reaching it, and I looked around and there were 3 very tall, magnificent young firefighters there. And so I went over to them, and I'm sure I looked, it was 6:30 in the morning, you all. I would say looked like I might have just climbed out of bed and had my pajamas on or something. But anyway, they were very helpful. But what I later learned about that, when I mentioned I ran into them, they were like, someone at the fire department was saying, well, what were they doing there? And it turns out they were on their way to Eastern Kentucky to help a lot of the folks. So above and beyond from getting a bottle of Crisco off the top shelf to going and helping save a lot of people in Eastern Kentucky. So thank you.
Here, here. Commissioner Sanford.
Thank you, Mayor. Just real quick, I just wanted to thank before this happens, the snow, which should be coming tonight, the street department. I get a lot of calls on snow removal all the time, and you guys you work a lot of hours, so I just wanted to make sure you thank your people because we appreciate it, because it would not be very fun not to have those guys around. And I just got back off this is a cute little story of a
We don't want to hear about your trip. We don't.
Yeah, you're going to hear about it.
Huh? Can you see how brown he is?
I was in Jamaica, and anyway, we think we have a pothole problem. Their potholes are as big as this section where everybody's sitting. And my driver, one afternoon, he said,
driver?
Yeah, he's driving the family. He's like, you've got to have a PhD to drive in Jamaica. And I was like, what are you talking about? He said, I'm a pothole dodger. That's exactly what we are here. We have to be able to dodge all the potholes. And he's right. So we do have potholes here, but nothing like they do. So thank you for that, too. And that's all I have.
Good. Well, my only announcement is I've been awarded, Barbara and I have been awarded great-grandparents. We've got 2 great-grandchildren coming, one in April and one later on in the year. I don't know exactly when it is. So pretty excited about that, because when you get our age, it's nice to have little ones running around a little bit every now and then. Okay, item 11. Who? What does that mean?
Oh, sorry, go ahead, Mayor.
Oh, go ahead.
No, I didn't have anything.
Oh. Open public forum. Members of the audience may address the Board of Commissioners on any matter of public concern that was not on the agenda. Comments are limited to issues within the scope and responsibility of the Commission. Commission meetings are held to conduct city business for the benefit of Owensboro citizens and taxpayers. This time, anyone who wishes to address the City Commission, please make their way to the podium to be recognized. Speakers must state their name and address for the clerk's record and limit their remarks to 3 minutes or less. Since the item's not on the agenda, no response is required from staff or the Board of Commissioners. The Mayor reserves the right to extend the time to the speaker. Okay, open public forum. What's the matter, James?
Hello, Robert Morris, 727 Maple Avenue. I was driving home the other day down Frederica, listening to my Taylor Swift cassette, and I turned on Maple Avenue, and there was a speed limit flashing trailer. Serves probably multiple purposes, but I don't speed on my street anyway. It's not in very good condition, and you get a chipped tooth or a broke ball joint, and at 64, neither one of those is good. So I slow down, but I got to wondering, what is the speed limit on my street? And so I drove from Frederica to Lewis Lane, and there's no speed limit signs on my street. So, and I drove up and down it several times. I'm thinking, man, I'm missing one because I miss a lot. So I was just wondering if there is, if we're supposed to have speed limit signs on our streets. I think the prevention would be there rather than the rehabilitation in regards to the speed limit things, because I don't pay any attention to those anyway. I don't speed. My car's old and I drive slow. So I would just like to ask if somebody could look into getting some speed limit signs on our street. That's Maple Avenue. I was glad to hear you mention about the TIF and the special projects that we've got going on. And I look forward, I'm interested in that, and I look forward to a better breakdown on the TIF, more explanation of where money is coming in and going out, especially on the downtown hotel. And on the special projects, when we talk about those, I wish there was more time spent on those in regards to what the initial budget was and where we are in change orders and things like that. Some folks spoke about transparency, and I think that would be good for the citizens to see where we started, where we finished, how long it took to start and finish, and did we hit budget, and where the change orders are. You hear about change orders when you listen to the county commissioner meetings, and it drives me nuts to listen to those because they're so, there was one for $300 and some thousand, and I thought to myself, holy cow, how do you bid a job and miss $300,000 and $400,000? So I like to see those kinds of things that interest me. And last but not least, I want to congratulate the mayor, all the city commissioners on their November election victories, and good luck in the future. Thank you.
Thank you. Anyone else? Okay, then. I make a motion to enter into closed session under KRS 61.810, parentheses 1, close parentheses, C, for discussion of proposed pending litigation. Could I have a second, please?
Second.
All in favor indicate by saying aye.
Aye.
And there will not be any other business following the closed session.